Oh yeah, thanks for getting in touch. What I'm going to try and do now is give you as much information about the area that you're having some problems with. Obviously, everyone's unique, so I can't give you an individualized diagnosis without having a good sit down and sort of two-way conversation. But what I can certainly do is give you the benefit of my sort of experience about the sorts of things that typically affect people that are suffering from something that sounds similar to yours, and hopefully that will be of a bit of use with helping you decide what you want to do. So I can see that you've had sort of pain down the side of your neck, and it's sort of particularly on turning the neck, and you've had it for the last month or so, and you're getting a few headaches with it. Now, I think the first thing is that necks are really tough. The amount of people that we see with neck problems that turn out to be something sort of sinister or really serious or needing sort of more than musculoskeletal health are quite small. They're evolutionary speaking, we've got our spinal cord, we've got all the arteries and veins, our brain sitting on top. So the neck's really quite a tough structure. But what it's sort of evolved to do is to move. So it gets particularly upset if it can't move, and that's what I think sort of obviously why it's so uncomfortable. So what's most likely to happen, the things that we see quite commonly, is that the little joints in the neck, so you've got 7 bones in the neck, and that makes your neck up. They have little sort of facet joints, they're called, at the back, and they sort of help control the amount of movement. Now, if anything happens around there and they get sort of little spasms around the muscles or get irritated, they shout out quite loudly, which is pain. And as you turn, you're putting quite a strong twisting force through the neck, which ordinarily it loves, because that's sort of what helps push the movement down into your back and get it all working together as a unit. But if you've got an irritation there, it really doesn't like it. Now, that's probably most likely what we see. An irritation to the neck, it might be more if it's sort of going like that hurts more than going like that, then that might mean more a bit of irritation in the joint. That might mean sort of more muscular, but these are little fine tunes around sort of trying to work out what's going on. The most important thing, as always, is understanding why it's happened. The bit that hurts, nearly always the victim, not the culprit. With necks, and I think the headaches will probably be related to the neck tension in some way if they've come on around the same time. And cervicogenic, meaning coming from the neck, cervical is just a sort of fancy word for neck, really, are quite common sort of headaches. So I would say that's probably likely what's happening. They're two related. Now, I'd be looking for the culprits. I'd be looking at the upper back and the muscles that go between the sort of rib cage and upper back and the neck, because nearly always I find that the culprits lie sort of adjacent to the structures that are in pain. So what if you think of a child, if someone calls their name, they turn around as a whole person. An adult is more likely to turn and sort of isolate out a movement, and that's sometimes what happens if we have a stiff upper back. We don't find it as easy to sort of turn as a big unit, so we then overwork our neck. So I'd be quite interested to see how you use your body, and if there's anything that's going on that might mean that the back's stiff, or if you do have any stiffness in the upper back, and that can be caused by lack of use, or it can be caused by things such as lots of breathing up here. So we use the muscles that are in the front of the shoulder and in the neck, and that tends to tighten us into that position, and then we can't turn because our neck's tight, and then that means as we're forcing it, we're overworking the neck. So an overload of the neck would be what I'm thinking, due to some sort of stiffness at the upper back, would be my sort of probably most likely culprit in this. And if we could work out that, then we'd really work on how we can get the upper back moving, as well as taking the tension out, because what I want is a resolution that lasts, not just a short-term sort of relief. So I hope that's useful. If you want to find out a bit more, just get in touch or book an appointment, and I can go through it in detail with you, and help you make a firm diagnosis and get it resolved. Bye bye.